Hi, I'm Dr. Anit Patel. I'm an ear, nose, and throat physician at Beth Israel Deaconess Hospital in Plymouth. Today I'm going to talk a little bit about sinusitis, acute and chronic sinusitis versus the common cold. So there's important differences between a common cold and an acute bacterial sinus infection. So 99% of times when patients have a cold, they're usually viruses that don't need to be treated with antibiotics. And so what I usually tell my patients that in the first 4 or 5 days of cold symptoms, such as a stuffy nose, yellow-green discharge from the nose, coughing up yellow-green phlegm, or low-grade fevers, those first 4 or 5 days you should do just conservative treatment that you can do at home. And so what does that mean? This means using a humidifier in your bedroom to sort of keep the nose and sinuses moist so that they can flow and help sort of flush out the infection. Using saline spray for the nose also to keep it moist. You can also use antihistamines such as Claritin or Zyrtec to help dry out the nose. You want to be careful about using decongestants like Sudafed because that could dry you out too much where things can't move at all. Now on day 5, if you're starting to feel worse or no better, this is probably when you're developing a bacterial sinusitis, in which case you may need an antibiotic. So this is the time that you should see your physician. There are many things you can do to prevent sinus infections. So first we have to know what is predisposing you to sinus infections. So this may be a good time to see your ear, nose, and throat physician, because if you're getting 3-4 sinus infections a year, they can take a look in your nose and see if there's some type of mechanical deformity that's predisposing you, or they can test you for allergies to see if there's an allergy that you're having that's predisposing you to these infections. The other thing that is important when you do get a cold is to make sure you're not blowing your nose. Okay, so usually the normal circulation of mucus is from the nose backward into the throat. So when you blow, you're actually blowing against the normal clearance method. So you're actually blowing stuff back into your sinuses. You're blowing stuff out of your nose, some green, yellow mucus, but you're blowing a lot of stuff back into the sinuses. So if you can, ideally, it's better to sniff in and sort of spit that out if you can. Not everybody can do that, but that generally is a better method than blowing your nose. So generally you can ask your primary care physician for an ear, nose, throat physician in the area. For us, in the Plymouth area, I'm part of the Plymouth Ears, Nose, and Throat practice, so you can either give us a call or you could visit us on our website at plymouthent.com.